Hello and welcome. I hope I'm audible. Yes. Okay. So welcome to this session and session again, repetition of what we did yesterday. Yesterday was about NEET PG high yield questions. Today also a similar category, but different category slightly. That is for FMG, foreign medical graduate exams. Anatomy high yield MCQs. I'm Dr. Ankit Khandelwal, MBBS MS in Anatomy, your anatomy educator in Unacademy platform. And this is a session, and in this session we are going to cover up some of the high yield MCQs from our anatomy perspective. Right. Today being 26th, tomorrow 27th, we have a med combat at around 12 in the afternoon. So remember tomorrow do remember to check it out, your med combat, right? And this is the latest news, that is tomorrow we have this. So latest upcoming thing is this, so be prepared for this. In this, I guess all the year question papers are different, so that will be beneficial. So see, let's move on to the MCQs for the anatomy, and here we go. This being the first MCQ. And there you go, guys. In the comment box, I hope some of you have joined now. Yeah. So in the comment box, you can write the options as A, B, C, D, or 1, 2, 3, 4, whatever you want to write. You can even call them as A, B, C, D. That makes not much of a difference. So the question goes that nerve liable to get injured on removing the fish bone from piriform fossa. So if you are operating on the piriform fossa, it could be fish bone or could be anything else. So what is the nerve liable to be injured? That is the question. Options over here are the superior laryngeal, internal laryngeal, external laryngeal, or the recurrent laryngeal. Okay. Basically, the question is about the anatomy of the piriform fossa. Again, a high topic. And I guess I discussed some topics yesterday and gave you a bit of homework. Those who were serious and who wants to really go through and do better in the exams must have done that, right? If not, then you can do it even now. So topic being piriform fossa, and what's the answer over here? Okay, 2 and 3 is Nathan going with the second, and Putin going with option number third, internal and external laryngeal nerve. Okay. So piriform fossa is a cavity, is a space where it's found in the hypopharynx. Found in the hypopharynx, also known as the laryngopharynx. It is actually cavity in the hypo or the laryngopharynx. And what is the nerve that is injured over here? And the answer for that would be what? Let me highlight it. And meanwhile, others are still thinking. It is not the external beta, it is the internal laryngeal nerve. It is the internal laryngeal nerve. No, it's just the second one. Internal laryngeal nerve, that would be the answer. Why? First of all, it is inside. So, how to answer these sort of questions if they will come in the exam? These sort of questions do come. So this is the any nerve, say for example the vagus nerve. It is giving off a superior laryngeal nerve, ये branch आ गई, and as it goes down gives off a recurrent laryngeal nerve. So you recurrent laryngeal nerve below, and imagine this is a superior laryngeal nerve. Superior मतलब ऊपर, it is present superiorly. Now this superior one will divide into internal and external. एक है I for internal, E for external. So the external laryngeal nerve, why are we calling it external? Because it should be supplying something externally. कुछ चीज बाहर होगी, it should be supplying it, and that is what happens. It supplies a muscle. Which muscle? The muscle name is cricothyroid. The muscle name is cricothyroid. It is present outside, meaning by outside the cricoid and the thyroid cartilage, not inside the larynx. It is present outside. It is the only extrinsic muscle of the larynx. So extrinsic muscle larynx is present outside, supplied by external laryngeal nerve. Why would this nerve want to go into the piriform fossa? अब कोई piriform fossa में जा रहा है, someone is entering piriform fossa, it is trying to gain entrance into the larynx. It is this internal laryngeal nerve which will pass through the thyrohyoid membrane, right, along with some of the other vessels, and then it passes through the piriform fossa and all that, and then it reaches your inside of larynx. So it is going inside the larynx to be sensory over there, right? So answer over here is internal laryngeal nerve. That is the answer. Let me show you an image over here. This is the image. Here you can see this is a recurrent laryngeal nerve being shown, so that is recurring back from here, from below. This is the internal laryngeal nerve over here. Now it is passing this, actually this hole is the piriform fossa over here. So this nerve is passing from lateral to medial to gain entrance into where? Into the inside of larynx, because it is actually sensory to the upper half of larynx. It is sensory to the upper half of larynx. That is its role, and therefore this would be the answer. Answer is internal laryngeal nerve. I have point clear. Let's move to the next one. So remember, the topic is piriform fossa. Do read this topic and especially look at some of the images of this topic, particularly your laryngoscopic images that comes in the exams. Laryngoscopic images showing you the piriform fossa and its boundaries and other associated adjacent structures. Let's move to the next one. Question number 2, that which of the following is a derivative of the second pharyngeal arch? Let me add one word over here, second pharyngeal or branchial arch. बताइए. What's the answer over here? The options over here are malleus, stapes, maxilla, or mandible. I hope straightforward question है. Try it in the comment box. Okay. Two stapes B. अच्छा हाँ सही है सही. Very good, very good. ठीक है. I guess point is clear over here. The answer is stapes. Answer is stapes. ठीक है. So all the other options, be it malleus, maxilla, or mandible, these are actually coming up from the first arch. Okay, just a second. All the other options, the first arch is known as the mandibular arch, and it gives rise to mandible, and its derivative is maxilla. And also the first arch gives rise to malleus and incus. Second arch gives rise to structures like stapes and styloid process, and the superior horn of the superior horn of the hyoid bone, upper part of body, and sorry, lesser horn, not the superior one, lesser horn, and upper part of the body of the hyoid bone. All these things are coming up from the second arch. Second arch, the nerve is the seventh nerve, that is the facial nerve. Second, that is the facial. Second arch nerve is seventh, that is the facial nerve. First arch, known as mandibular arch, the nerve supply for the first arch is itself is the mandibular nerve. Right? I'll just show you an image showing you all the skeletal derivatives of the arches. Where this number 1 is written over here, so that is representing the first arch. You can see Michael's cartilage, the mandible, and the malleus and the incus. Second, shown up with this blue color, you can see stapes, styloid process, lesser horn, and your upper part of the body of hyoid bone. Third arch, this yellow color, lower half of the body of the hyoid. Fourth and sixth arch, they give rise to the laryngeal cartilage. Both fourth and sixth, they give rise to the laryngeal cartilage. Now, what to do? See, it is straightforward. The question was not very difficult, but the topic over here is again pharyngeal arch. If you don't know this topic, please go through it. How to go through it? You have various sources. Else, we have the special classes over here in Unacademy, special topics for pharyngeal arches. Please go through it. There's one of the most high topics of embryo as well as head and neck. Right? So second arch derivatives is stapes over here that we should know. And just a hint over here, if you want to remember कि कैसे याद करें, tell me the muscle associated with stapes. And if you are thinking of stapedius, correct. The muscle associated with stapes is stapedius. Very good. And tell me the muscle associated with the, let's say example, malleus. In the middle ear, we have the tensor tympani. I hope you remember them. Anatomy of the middle ear. Now think about the nerve supply of the tensor tympani is mandibular. Why? Because it is actually first arch. And what was the nerve of the first arch? Mandibular. The nerve supply with stapedius will be facial nerve. You know the answer. Why? Because this whole embryologically is coming from the second arch. And second arch nerve supply itself is facial. Just giving you a few hints how to go through them. Right? So these hints over here will try to sort you out. All the muscles attached to the mandible are the masticatory muscles. Again, nerve supplies. Got the point? Mandibular nerve. So these things make some tricks over here or some logic over here to help you understand. Let's see the next question then. And here comes the next question. Okay, and the embryology over here. All the best. Embryology question. The crystalline lens is derived from. Crystalline lens of the eye is derived from. आँख की जो lens होती है, which is the bread and butter of the ophthalmologist, cataract and all. But that lens is embryologically coming from where? Is it surface ectoderm, a neuroectoderm, mesoderm, or endoderm? A, B, C, D. Yes, try to give the answer. All the best. Putin, I didn't got your message. What is that? Number 2 option? Nitin is going with the second option. Crystalline lens. Crystalline lens is derived from lens of eye. आँख के अंदर होती है lens. Lens is inside the eye. I see. There are two things over here. You have to understand there is an outside surface ectoderm. बाहर की तरफ you have a surface ectoderm. Remember it. Surface ectoderm. Inside you have the brain development, that is a neuroectoderm. Okay? It gives off a diverticulum over here which will form the cupping and all. That is the optic stalk. वो बनती है optic stalk. It forms the optic nerve, the retina and all that. The surface ectoderm, it forms a vesicle inside. And that will detach and that is going to form the lens. Got the answer? Yes, Shyam and Putin. Answer is option number A, that is the surface ectoderm. Answer हमारा A, the lens is derived from the surface ectoderm. And mind you, if you read ophthalmology, you will read, I guess, in the textbooks that the lens is one of the rare structures in the body which keeps on growing throughout the life. Zindagi bhar ye badhta rehta hai. Therefore, we have cataract and other issues. Lens is one such structure in the whole body, not just the eye, which keeps on growing throughout the entire lifespan of an individual. So surface ectoderm will be in the next slide. What I'm going to show you is going to help you a lot. What is this? This is the whole table. Basically, development of the eye is being shown over here. What you need to study over here is derivatives from neural ectoderm. This is important. And these all you can see: optic nerve, retina, and these two are important. But more importantly is this third option that comes a lot in exams. Please understand it. That is the smooth muscles of the iris. Muscles of iris, muscles or any part in the body, they're coming from neuroectoderm or ectoderm. Muscles normally we link a muscle with the mesoderm. But here the muscles of the iris, the smooth muscles, both sphincter and dilator pupillae are coming from neuroectoderm. Please understand it. It is very important. Pucha jata hai, it is commonly asked. So you have to understand this neuroectoderm. Second is the surface ectoderm, which was recent. I just asked, this was the question that was asked, lens. Uske alawa, apart from this, the surface is from the outside. So bahar jo bhi hai, the cornea, the conjunctiva, these are all coming from, and the glands over here coming from surface ectoderm. But you have to understand these two only. Uske alawa jo bach gaya, make it fall under neural crest and mesoderm. Khatam. In the development of the eye, at least remember these two: what is coming from neuroectoderm, what is coming from surface ectoderm. Bas. 3-4 structures in both the sides. That's it. Uske alawa jo bach gaya, you pull it up into neural crest or into the mesoderm. That's all. So lens over here is surface ectoderm. I hope point is clear. एक और करते हैं सवाल इसी बात पे. Okay, very good. Head neck question. In a peritonsillar abscess, around the tonsil there is abscess. In a peritonsillar abscess, the pain is referred to here. Now, tonsil are there in the oropharynx. Pain is being referred to ear. Why? Which nerve? Which nerve is there? A, B, C, D. A is facial, B is glossopharyngeal, C is vagus, and D is your auriculotemporal. बताइए. They were going with option number B. Putin again going with A. Pain is referred to ear. That one of those nerves should be supplying the ear also. By common sense. If you don't know the answer, कोई बात नहीं. You should know that one of the answer should be supplying should be sensitive to the ear. ये तो होना चाहिए. That is understandable ना. ये तो पता होना चाहिए. Which part of ear could be any part. In that case, you should know what is the nerve supply of the ear. उसके बाद you should associate that nerve with the tonsil. भाई वो tonsil के आसपास है. Which tonsil are we basically talking of? Is the palatine tonsil. That I hope is understandable to all of you. हाँ जी, which is the common nerve. तो B ऑप्शन में आ गया, D भी आ गया. अच्छा, ठीक है. Auriculotemporal nerve, ठीक है. It supplies ear, पक्का. Is there any association of auriculotemporal nerve with the palatine tonsil? सोच के बताओ. Let's see option. ये ऑप्शन ढूंढते हैं. This nerve is branch from where? It's a branch of mandibular nerve. ठीक है ना. And what is this nerve doing? It is pure sensory. तो sensory है. The mandibular nerve, if you recall, the mandibular nerve has an anterior division and a posterior division, or anterior trunk, posterior trunk. Posterior trunk gave rise to one of the three branches, and those three branches, ALI, and this auriculotemporal nerve, A stands for auriculotemporal nerve. Okay? This is pure sensory. Okay, sensory. But it is running in the auricle as well as temporal region. Ye area has. Is it going to the tonsil? Answer is no. Is that has this nerve any relation with the tonsil? ठीक है जी, तो नहीं बन पाएगा. बात खत्म हो गई. इट इज प्रेजेंट आउटसाइड tonsil. अच्छा, और नर्व देखते हैं. लेट्स सी अनदर नर्व. वेगस आल्सो सप्लाइज ईयर. हाँ जी, इट्स आल्सो सप्लाइज ईयर. आउटसाइड एक्सटर्नल ऑडिटरी कैनाल, आर्नोल्ड्स नर्व सप्लाइज ईयर. बट इज वेगस नर्व रिलेटेड टू द टॉन्सिल? सोच के देखो. इज वेगस नर्व वेरी क्लोजली रिलेटेड टू द टॉन्सिल कि हाँ इसमें एब्सेस होगा. सो कैन दिस नर्व बी इरिटेटेड? ये सोचने वाली बात है. Then we have vagus nerve. Tonsils related है कि नहीं? सोच के देखिए. Vagus nerve is running inside the carotid sheath. पहली बात तो, if you remember, vagus nerve, we have a carotid sheath in which we have a artery, carotid artery, and lateral to it, what we have a vein, interjugular vein, और इनके बीच में we have this nerve, which is the vagus nerve. I hope you remember this, and that is all covered up in the carotid sheath. Is this in touch with the tonsil? Answer is no. ये भी tonsil के touch में नहीं है. Then comes the facial nerve. Again, facial nerve, does it supply the ear? हाँ, there may be a couple of supplies in the ear, but answer beta B है. Some of you went with the B. Glossopharyngeal is the answer. अब कैसे हमें how in the exam कैसे सर कैसे रीच करना है glossopharyngeal nerve? एग्जाम में यहाँ पर वी कैन थिंक ऑफ इट, चलो एक बार को यू टॉट अस फाइन, बट एग्जाम में क्या, एग्जाम में यू आर नॉट देयर, वी आर ऑन अवर ओन, आप तो छोड़ के चले जाओगे, वी आर ऑन अवर ओन, एग्जाम में कैसे करें सर? देखो ये नाम पढ़ो इसका, ग्लॉसोफेरिंजियल नर्व. ग्लॉसो मींस व्हाट, टंग, फेरिंग्स तो फेरिंग्स हो ही गया. सो कैन इट बी रिलेटेड टू टॉन्सिल? आपका कॉमन सेंस क्या कहता है? हाँ यार होना चाहिए, बिकॉज टॉन्सिल इटसेल्फ इज इन द ओरोफेरिंग्स. ये नर्व तो होनी चाहिए टॉन्सिल के पास, because this nerve supplies sensitive tonsil. Yes, it is related to tonsil. अब can you associate this nerve with ear? If yes, then which part of ear बताइए. Ninth nerve I am saying associated with ear. You have to tell me which part of ear. सोचो, देखो we have made a connection of pharyngeal nerve with tonsil, तो बन गया. Tonsil अपने आप में it is inside the oropharynx, ये pharyngeal nerve है, connection बन गया, होता है. I'm just asking you, ग्लॉसोफेरिंजियल नर्व का ईयर से कोई कनेक्शन निकाल पा रहे हो? जैकबसन्स नाम सुना है? जैकबसन्स नर्व, ईएनटी. टिम्पैनिक प्लेक्सस सुना है? सब सुना सुना होगा. टिम्पैनिक प्लेक्सस, जी हाँ, इट इज रिलेटेड टू द ईयर, वेरी मच रिलेटेड टू द मिडल ईयर. अब तो याद आ गया होगा, कुछ याद आ गया. तो दिस नाइन्थ नर्व इज द सेंसरी सप्लाई ऑफ द मिडल ईयर. मिडल ईयर की सेंसरी सप्लाई है ये. फॉर्म्स द टिम्पैनिक प्लेक्सस ओवर द प्रोमोन्ट्री. Okay, and this nerve is related to the tonsil. Now here is a section of the tonsil. This is the tonsil that is being shown to you, just to show you where is the glossopharyngeal nerve is very 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 close to the tonsil. याद रखो, glossopharyngeal nerve is very very close to tonsil, and that is why if you ask the ENT surgeon, if you go to the ENT department, there they will say that if they plan a surgery of tonsillectomy, that किसी बच्चे का उन्होंने plan की that we have to remove the tonsillectomy, while in the pre-op, before going for the surgery, they will advise or they will tell the parents of the patient that after surgery the child may have few days where he may or she may have earache. कुछ दिन उसके कान में दर्द हो सकता है, that is normal, you don't have to worry, because while doing tonsillectomy this nerve gets irritated, it sends a referred pain to the ear. याद रखो, so there can be few days of referred pain in the ear, that is normal, no need to worry much about it. ये याद रखना, ठीक. तो कंबाइन, तो हमें अगर आंसर नहीं पता है, try to reach out. It's not impossible. You all have read everything. बस थोड़ा सा बैठ के cool mind से 1 मिनट सोचो, answer can come. I'm not saying it will come. Good chances it can come. Next question देखते हैं भाई. Okay, a long question. चलिए, try to answer this. Axillary artery. I'm moving to the upper limb topic. Axillary artery has become progressively occluded deep to the P minor muscle. भाई यहाँ पर axillary artery जो होगी ये बंद हो गई. Became occluded deep to the P minor muscle. अच्छा, कोई बात नहीं. Which pair of blood vessels would most likely provide a significant collateral circulation around the blockage? So here you have a muscle that is P minor. मान लो ये muscle है P minor, ठीक है? Just imagine, and इसके deep में you have an artery over here which is getting occluded. ये occlude कर गई. Okay. Then what collaterals can supply the upper limb? Options are A, B, C, D. बताइए. A is posterior circumflex humeral artery and anterior circumflex humeral artery. We can simply write as posterior PCHA and ACHA. Second option is subscapular artery and posterior circumflex humeral, subscapular, suprascapular, lateral. बताइए भाई. Take your time. There is a blockage of axillary artery deep to P minor muscle. अब कौन सी artery will provide collateral? All the rest. बताओ भाई. Vibes going with the option number B. Shyam going with option number D. ठीक है, कोई बात नहीं. Let's wait for 10 more seconds. सोचो. एक आर्टरी ब्लॉक हो गई है. Which vessels can provide collateral circulation? ये क्वेश्चन. ओके, नॉट मैनी अटेम्प्टिंग. चलिए जी, आंसर पहले कर लेते हैं इसका. आंसर इज नाइदर बी नॉर डी. आंसर ना तो बी है ना डी है. आंसर है सी, सबस्कैपुलर आर्टरी एंड सुप्रास्कैपुलर आर्टरी. दिस इज द आंसर. ठीक है भाई, पहली बात तो आंसर शुड बी क्रिस्टल क्लियर. व्हाट इज आंसर? दिस इज द आंसर. कैसे? नाउ द थिंग कम्स हाउ. फॉर टू अंडरस्टैंड हाउ, देखो, there is an artery, ये एक artery है, it is getting blocked over here, यहाँ due to any reason it is getting blocked. So proximal, यहाँ से there should be some branches and distal there should be some branches, they should anastomose. Simple common sense. And they anastomose around the scapula. So it is a topic का जो नाम है, that is scapular anastomosis. Go through it in the upper limb. Scapular anastomosis. What happens is proximal to the blockage there is a subclavian artery. कौन सी artery? Subclavian artery, and this will give off branches like suprascapular over here or dorsal scapular artery. ये सब आती हैं from the subclavian artery. And distally, this is the third part of axillary artery, and this gives branches like subscapular, और इसकी branch आती है circumflex scapular. So circumflex scapular artery, subscapular artery, they are coming from the distal parts, and suprascapular or dorsal scapular, they are coming from the proximal part of proximal to the occlusion, and they anastomose with each other, and they bypass this obstruction. क्यों? Why do we need a scapular anastomosis? So that this obstruction should not lead to total necrosis of the upper limb, because upper limb में एक ही artery जा रही है. In upper limb, only one artery is entering, that is the brachial artery, that is axillary. Axillary will become the brachial artery. So it is only this artery. अगर ये artery block हो गई, then upper limb unnecessarily will go to necrosis. खत्म. Therefore, you have a scapular anastomosis. Let me show you an image over here. This is the right side of the scapula which you are seeing on the posterior aspect. पीछे से आप देख रहे हैं right side scapula, posterior view. This is the posterior view. Have a look at it. This is the right subclavian artery underlined, and that is the axillary artery underlined. Subclavian say you have branches like suprascapular artery and also the deep branch of transcervical, also known as dorsal scapular artery. तो ये दो branches आ रही हैं subclavian से, S/C, and they are ramifying the scapula. Same way as this axillary arterial third part is gives off the subscapular artery coming from axillary, and its branch is known as circumflex scapular artery axillary. You can see these four arteries. I may highlight it. That would be a better idea, I guess. Deep branch of the cervical, suprascapular artery, subscapular, and these are hovering around the or anastomosing around the scapula. So that if there's been block in the axillary artery, blood should reach somewhat to the upper limb so that the upper limb does not go into necrosis all of a sudden. Topic is scapular anastomosis. Topic पढ़ लेना बेटा. This is important clinically. आजकल clinical questions आ रहे हैं बहुत ज़्यादा. Nowadays there are a lot of clinical questions. I hope you know, and this is a repeated question. It is not a new question. This is a repeated question. So be prepared for this. Okay. So let's see another one. Okay, all the best for this. A 52-year-old lady was found to have infection in the adductor canal. Adductor canal में infection. Fine. कहाँ पर? Adductor canal. Its other names are subsartorial or Hunterian canal. Just for your information. So, a lady having infection in the adductor canal, damaging the enclosed structures. Which of the following structures remains intact? अच्छा जी. So, actually the question is, which of the following is not a content of adductor canal? Question ये है. So they have replaced in two lines. Infection हो गया, which structure will remain intact? Femoral artery, femoral vein, great saphenous, or third option saphenous nerve, and great saphenous vein. Third, fourth option. All the best. बताओ क्या लग रहा है आंसर? Vibes going with option number D. अच्छा जी. और बताइए. More input. Think. Which is actually not a content of adductor canal. इतना मैंने बता दिया. The rest up to you guys. बाकी आप लोग sort out करो. Only one answer has come till now. No one attempting. There is no negative marking. ये तो पता ही होगा. Attempt करो. Wait for 5 more seconds. चलो हो गए 5 seconds. So adductor canal. There are a lot of structures in the adductor canal. Yes, Vibes, you are absolutely correct. हाँ जी, Shyam also joining you. Answer is great saphenous vein. Answer is great saphenous, without a doubt. चलिए, a little bit of anatomy देखो. We have, if you look on the second side, left side, this is the midline. Left side में, this is your say femoral triangle. ये आपका आ रहा है femoral triangle. Right, this is a muscle on the lateral side known as sartorius. and this sartorius muscle will actually go down, and then this femoral triangle will continue deep to sartorius as a small canal. इसको बोलते हैं adductor canal. We call it as adductor canal. AD है, not P. It is ADD. Adductor canal. It is also known as subsartorial. क्यों? I guess you can see it is below sartorius muscle. Subsartorial canal. What happens is there are femoral vessels in this particular femoral triangle. Femoral artery and femoral vein. कौन जल्दी बताएगा? Femoral vein, where should I draw it? Medial to the artery or lateral to the artery? कहाँ बनाना चाहिए? Where should I draw it? Femoral vein, where should I draw it? Medial or lateral to the artery? जल्दी बताओ. Let me see. LEVAN, medial to lateral. अच्छा अच्छा. नहीं बेटा वो मुझे ठीक है. Tell me femoral vein should I draw medial or lateral to the artery? इतना बताइए. देवंगन इसे लेटरल होता है, मतलब वेन यहाँ बननी चाहिए. अच्छा लेटरल बननी चाहिए. अच्छा हाँ हाँ, LAT इज लेटरल, फाइन, समझ गया. पांडा इसे मीडियल बननी चाहिए. अच्छा जी, दोनों तरफ वेन कर दें. इस बढ़िया है. एक्स्ट्रा वेन है, प्रॉब्लम क्या है? अगर यहाँ से इफ यू आर नॉट एबल टू सर्च दिस, ये एक तो मिल जाएगी. एक चीज बताओ, लेटरल मीडियल. बेटा जो निमोन बताया था इट वाज एब्सोल्युटली करेक्ट, एंड देयरफॉर सबसे बाहर है नर्व, then artery, then vein, then empty space having a lymph node. So vein होगी medial, and this vein goes down towards the apex of femoral triangle, similar to the artery which also goes down towards the apex of femoral triangle, and they both will go through the adductor canal. So both artery and vein are contents of adductor canal. ये बात समझो. Then we have a saphenous nerve also as a content. Now few people might think the logic is not fitting. Saphenous nerve is a cutaneous nerve. ये इतना डीप क्यों है? Your question is absolutely correct. अगर ये question आपके mind में आ रहा है, this question is coming to your mind, absolutely correct. But this nerve is a cutaneous nerve, subcutaneous or cutaneous nerve. It's a branch of femoral nerve. तो ये deep क्यों है? Because this nerve is cutaneous where? Not in the thigh, it is cutaneous in the leg and foot. याद रखो, thigh में it is not cutaneous. It's cutaneous distal to the knee. तो यहाँ पर it is content. Apart from A, B, and C, the other content of the adductor canal is nerve to vastus medialis. एक ये भी याद कर लो. जब इतना याद कर लिया है, then remember to learn one more thing, nerve to vastus medius. ठीक है? देवांगन, देवांगन, I asked, vein is medial or lateral to the artery? At that location, the vein was medial to the artery. ठीक है? Clear? एक मिनट, let me try to clear this up. Point clear? सबसे lateral में you have the nerve, then artery, then vein. So vein is medial to the artery at the top of femoral triangle. So the fourth content is nerve to vastus medialis. Great saphenous vein, it is a subcutaneous or a cutaneous vein. है ना? So this lies superficially, ये बाहर होता है. It is not in line the subsartorial canal. फिर से चलते हैं. In the femoral triangle, artery is lateral, medial to it is the vein. Nerve है सबसे lateral, यहाँ बाहर है femoral nerve. And they both go towards the apex of femoral triangle, then they both go inside the adductor canal. So both are content of adductor canal. इनके अलावा you have the saphenous nerve also as the content. So saphenous nerve is a cutaneous nerve. Some students argue in our classes कि नहीं सर cutaneous nerve है, ये अंदर कैसे हो गई? Because this is cutaneous in the leg region. So ऊपर तो deep है. This actually, let me show you that over here it is a femoral nerve. ये नीचे आई, it is giving off saphenous nerve. यहाँ पे निकली saphenous nerve. It is till now it is deep. As it crosses the knee, then it becomes superficial and supply the leg and foot, medial part of leg. And the fourth content of the adductor canal is nerve to vastus medialis, again a branch of femoral nerve. Problem clear, I guess? ठीक. Let me show you a TS. अगर यहाँ पे हम TS लेते हैं, if we take a transection to adductor canal, it appears somewhat like this. इस तरह से दिखता है. Right, this is the lateral side, that is the medial side. आराम से देखो, lateral and medial side. ठीक. उसके अलावा this over here part I'm highlighting, that is the adductor canal. This over here is the adductor canal. See the content: femoral artery, femoral vein, nerve to vastus medialis, and this nerve is saphenous nerve. The चार content दिखाए. And the vein that is lying outside is great saphenous vein. That was the answer. This is sartorius and it is a subsartorial canal. Which clear हुआ? It is a TS at the middle to lower 1/3 of the thigh, showing you these various structures and the adductor canal. चलिए एक और क्वेश्चन करते हैं on the histology perspective. बताइए, the type of the structure shown in the following slide is found in. तो डायग्राम है, ये कहाँ मिलता है? Is it found in the intervertebral disc, articular cartilage, articular disc or pinna? What do you suspect by seeing this? ये क्या है? What is this? What is this over here? बताओ. Which structure is shown over here and where it is found? Devangan going with option number B. The structure that is shown over here is hyaline cartilage. This should be clear. It is hyaline cartilage, and as a hyaline cartilage, it is seen where? It is seen in the articular cartilage. Articular cartilage is the cartilage which is covering up the bony ends that forms the joint. These are the bony ends. Okay, and the cartilage covering this, so that is known as the articular cartilage. This is hyaline in character. So cartilage over is hyaline. Why? Hyaline means glass-like, transparent. The matrix over here looks transparent. That is what it is. It doesn't mean that it has no structure. Only it has fibers and all, but the refractive index of the fibers as well as the matrix is same. The matrix दिखती है glass एकदम clean. Hyaline cartilage. हाँ, Vibes articular cartilage हो गया आंसर. जी हाँ, बिल्कुल सही बात है. Let me show you a slide comparing all the three types of cartilage. तीनों तरह के cartilage are shown over here. All the three types of cartilage are shown. On the left hand side, this is the hyaline cartilage. We have just seen the matrix appears transparent, कोई fiber नहीं. On the middle side, you have a similar structure but a lot of fibers, and these are elastic fibers, elastic cartilage. Seen in pinna, eustachian tube, external canal, and all. On the rightmost part, the third image over here is the third type of cartilage, that is a fibrocartilage. Why? Because the fibers over here are so thick, collagen fibers are so thick that the chondrocytes, they appear in rows. A row of chondrocytes. They form a row of chondrocytes. And that is the feature of fibrocartilage. If you look at the other options, intervertebral disc, fibrocartilage, articular disc, fibrocartilage, pinna, elastic, articular cartilage, hyaline cartilage. Answer therefore became B. Right? चलो एक बार बताओ. Repeated question है भैया. Killian's Dyson's. Killian's Dyson's is seen between. कहाँ मिलता है ये? It is seen between cricopharyngeus, thylopharyngeus, middle inferior constrictor, stylopharyngeus, salpingo, or salpingo palatopharyngeus. Not very difficult. Often repeated question है. I don't think you need much of a time for this. And as I can see, हाँ, अब देखो फटाफट सबके आंसर निकला है. Vibes and Shyam. Yes, answer over here is crico and the thylopharyngeus. These both parts are the parts of inferior constrictor. उनके बीच में they have a slight gap in between them, and the nerve supply is different, the direction of fiber is different. So there is a deficiency in the wall, a weakness in the wall known as Killian's Dyson's, and it may give rise to, I'm saying, the Dyson's is normal. But if it gives rise to diverticulum, that is a problem, and the diverticulum is known as the Zenker's diverticulum. This diverticulum का नाम है Zenker's diverticulum. The Dyson's is normal, it is present in all of us, but if the diverticulum appears, that is Zenker's diverticulum. Answer is between crico and thylopharyngeus. Both are parts of inferior constrictor. Let us in image might help us. That is anterior, that is posterior, superior, middle, inferior constrictor. As you can see, this inferior constrictor over here is attached to both thyroid and cricoid cartilage. Because यहीं पर कहीं there is a slight Dyson's over here. Weakness over here because thylopharyngeus fibers are more oblique, the crico are more transversely placed. And there is a small gap that might be in between, and that is known as our Killian's Dyson's. Okay, repeated question है. Don't mark it down. गलती मत करना. अगला देखो. That is also nowadays quite asked. The intractable cuff reflex on scratching the floor of external auditory meatus is due to which nerve? आपका ये, this is the external auditory meatus, and if you are scratching the floor over here, a cuff reflex appears. You start to cuff. कैसे हो गया? Which nerve is responsible for it? Cuff reflex on scratching the floor. तो उसके देखो, what is the answer? Vibes going with option number B, auricular branch of vagus. Okay. Any other person? बिल्कुल सही बात है. कफ, again कफ is a motor response where we use the muscles of larynx pharynx. खास कर देखो we are using the muscles of larynx pharynx and these muscles are supplied by vagus nerve. तो पहले तो vagus nerve is associated with the efferent part of the cuff reflex muscles. ठीक है. Is the vagus supplying the external auditory canal? Answer is yes. Again भाई auricular branch, नाम भी इसका auricular branch है. Okay चाहिए Arnold's nerve. Therefore, if vagus is supplying the external auditory canal and it is a efferent component of cuff reflex, it is quite possible that if you scratch the ear canal, there can be a cuff reflex. As simple. Okay? Am I clear? If you look at the great auricular, it does it supply ear? Yes. Has this nerve any role in the cuff reflex? No. खत्म करो बात. Any other nerve, they have no control on the cuff except this option number B, and therefore B is the answer. Therefore B is the answer. Clear? Let us see over here the कुछ nerves देख लो. This is the great auricular nerve, C2 C3 nerve supply. Auricular temporal nerve, branch of B3, which we already discussed. Okay, but they are not going for the cuff, but this 10th nerve over here, it is a very important part for the cuff reflex as well. Cuff reflex as well, or it is supplying the canal inside, posterior inferior part of the external auditory canal, and anterior superior part or anterior half of the canal by the auriculotemporal nerve. Remember this. Okay. आगे एक और बताओ. I think that is also a very important topic. Frey syndrome, gustatory sweating. When you start to salivate and simultaneously there is sweating. So this Frey syndrome or gustatory sweating is due to lesion of. इसकी वजह से होता है. Is it ninth nerve, quadritemporal, trigeminal, auriculotemporal? ये क्वेश्चन बहुत पूछा. अरे वाह. Frey syndrome आते ही everyone ready with their answers हैं. बिल्कुल सही. No doubt about it. Answer is our auriculotemporal nerve. Yes. How? Question is how. Auriculotemporal nerve. What is the role of auriculotemporal nerve over here? See, if there is any penetrating wound over the parotid region पे या तो there is any injury or a wound or there is any surgery being done over there, कुछ भी ऐसा होता है. And what happens is, inside the parotid gland, the post ganglionic fibers are auriculotemporal nerve fibers. समझो बात. The skin over here is the great auricular nerve. The nerve supply of the skin over here is the great auricular nerve C2 C3. These both are very close by. We have seen the previous image. हमने यहाँ देखा है auriculotemporal nerve and great auricular nerve. They are very close by. But this nerve over here is sensory. Else it becomes post ganglionic and it goes inside the parotid gland. ये भी याद रखो. So now what happens is that once the person sees the food and after any surgery and all, these two nerves they gain cross connection with each other. So when a person sees the food, obviously the parotid gland is stimulated, this nerve is stimulated, and this nerve also stimulates this nerve, and that leads to sweating. जैसे बोलते हैं gustatory sweating. हाँ जी, after parotid surgery. हाँ, this cross connection. Therefore, this syndrome is also known as auriculotemporal syndrome. इसका नाम ही दूसरा auriculotemporal syndrome है. Remember that also. Frey syndrome is also known as auriculotemporal syndrome. या तो सर्जरी हो या फिर there is an injury or a penetrating wound. After healing of that, it could be a feature. Clear? Remember this. चलिए एक और क्वेश्चन बताओ. You are examining the liver during a surgical procedure. अब आप सर्जरी कर रहे हो, doing a surgery in the intestine or a stomach or a liver, कुछ भी. Examining the liver. The gallbladder will be found in the fossa between which two anatomical lobes. Gallbladder आपको मिलेगा obviously if the patient has not undergone cholecystectomy, gallbladder मिलेगा. That is present between which two anatomical lobes? Anatomical lobes क्या होगा? ABCD. Options are A is quadrate and left lobe, B is quadrate and caudate lobe, C is right and quadrate lobe, D is a caudate and right lobe. Gallbladder is seen between which and which anatomical lobes is the question. Sham goes with option number C. ठीक है भाई, right and caudate. अच्छा. Okay. Let us wait for a few more seconds. Liver की anatomy is important. Anatomy of the liver is important. Quadrate confirm. अच्छा, quadrate confirm. बेटा quadrate तो 3 में है. फिर क्या करें अपन? Quadrate तो आदिल 3 में है ना. अगर सबके सब C पे जा रहे हैं, क्या करें? Let's go with C only भाई. Democratically let's go with C. भाई चलो C सब बोल रहे हैं तो C पे लगता है C ही होना चाहिए. So liver anatomy and basic lobar classification, that is important. हाँ, confusion अभी दूर होता है. So this is the, imagine the liver over here. ये आ गई आपकी liver. Initially, there was a falciform ligament that used to classify the liver into a right and a left lobe. So पहले इसको बोलते थे this whole is the right lobe, ये smaller one is the left lobe. Then other researchers came and you see the fundus of gallbladder over here and you see a IVC behind it. इसके पीछे मिलती थी IVC. And you see a gallbladder over here. Then they said, no, this line which is connecting these two structures, this should divide the liver into right and left lobes. Physiologically, functionally, and morphologically, this should be, and this exactly is. अब anatomy मैंने कहा ठीक है, we are taking this cholecystocaval line. We call it as cholecystocaval line. Cholecysto means for the gallbladder, caval is for the IVC. Cholecystocaval or Cantley's line. We take this and we divide the liver into right and left lobe. ठीक है, इतनी बात क्लियर. तो गॉल ब्लैडर कहाँ है? गॉल ब्लैडर इज बिटवीन राइट एंड लेफ्ट लोब. अब यहाँ पर तो राइट एंड क्वाड्रेट लोब है, राइट एंड क्वाड्रेट लोब है. दोनों में से क्या चुने? Which one to choose? This whole structure in front, anteriorly, this whole structure over here, part of left, that is quadrate lobe. आगे वाला पार्ट क्वाड्रेट होता है. Where is quadrate? Quadrate is segment number 1 present behind and posteriorly. पीछे की तरफ होता है. Quadrate lobe is quite posteriorly. आंसर सी ही है. Absolutely correct. Gallbladder is between the right lobe and the quadrate part of the left lobe. Quadrate is our segment number 4. There are, I guess, around 8 segments. Quadrate is segment number 1. Again, liver, if you guys have problem in liver anatomy, either you study whatever resource you have or go to the Unacademy platform, search my name, usme you will find classes on liver. So देखो, in high speed, save your time, develop concepts, because there are various fissures and various structures in the liver. Here, for example, an image over here showing you few fissures over here, like a right portal fissure, left portal fissure, and a main portal fissure. Few fissures over here. There are few major fissures, few minor fissures like umbilical fissure and others. These are 4 sectors. So there is sectoral anatomy, there is segmental anatomy, there is fissure anatomy. Liver. It's a detailed topic, but try to understand. This is segment number 4. This is your quadrate lobe. ये है हमारा बड़ा सा quadrate. It is so big, divided into 4A and 4B. और जो quadrate था segment number 1, that this is the segment number 1, that is quadrate. छोटा सा है, पीछे की तरफ है, posteriorly. So gallbladder over here, this is the location of IVC. Actually IVC दिखाया है. These are all the hepatic veins. This is right, middle, and the left hepatic. Gallbladder is actually located over here between the right lobe and the quadrate. Point clear somewhat? Kuch clear hoga? If you have any doubt, I'm saying again, have a look at that whole topic. Okay, couple of more questions. I think is fine. एक दो क्वेश्चन और करते हैं. Abduction at the hip joint is done by, simple question. सीधे खड़े हो, पैर बाहर निकालना है. You take the whole lower limb, move it outside. That is known as abduction. कौन कराता है? So these are the lower limb. If you take the lower limb outside, अब पैर हो गया आपका ऐसे. That is abduction. This is abduction of the lower limb. Which muscle is doing it? हाँ जी, what are the answers? अरे अरे A B B B B B B B B. Okay, one went with A, उसका सारे B B B पे आ गए. क्या करना भाई? सारे most of you going with B option. So what can I do? कुछ नहीं कर सकता. B करना पड़ेगा. ज़्यादातर लोगों को B लग रहा है, then B कर देते हैं. अगर A आंसर हो तभी B कर देंगे. ठीक है? हाँ, B is the answer. A आंसर नहीं है. B is the answer. Abduction should be done by a muscle which is present laterally. जो muscle बाहर होगी, this muscle will contract and it will cause abduction. Abduction कराएगी. But a Gmax is present more posteriorly. इसकी location posteriorly है. Therefore, it causes extension at hip. याद रखो. G medius and G minimus, they both causes abduction. ये दोनों कराती हैं abduction. These are small lateral rotators. These both are small lateral rotators. Small lateral rotators. याद रखो at the hip joint. हाँ, got confused. Gluteus medius and minimus होगा. हाँ वही है बेटा, वही है. Minimus medius ही है. Confuse मत हो. इसके लिए I will tell you एक और टॉपिक है. Do read it. Khandelwal test. सारा confusion दूर हो जाएगा. Go and study this test tonight. अगर कोई confusion बचा है, that will be clear. Okay, so abduction is done by G medius minimus, and if I ask you its nerve supply, कौन बताएगा? I'll wait in the comment box. टेल मी द नर्व सप्लाई ऑफ जी मीडियस, इसका नर्व सप्लाई क्या है? दिस आई वांट आंसर फ्रॉम यू गाइस। बताओ भाई क्या नर्व सप्लाई है इसका? जी मीडियस एंड जी मिनिमस दे शेयर अ कॉमन नर्व सप्लाई। हाँ, सुपीरियर एसजीएन, इंफीरियर एसजीएन, आदिल से अच्छा जीएन, पहले इंफीरियर देन जीएन, सुपीरियर है इंफीरियर? इट इज ईदर सुपीरियर ग्लूटिल नर्व या इंफीरियर ग्लूटिल नर्व, इन दो में से एक है, क्या चूज करना है? अच्छा, मोस्ट ऑफ यू गोइंग सुपीरियर, सुपीरियर पे जाते हैं, अगर ज्यादातर लोग जा रहे हो हम भी जाएंगे। मीडियस एंड मिनिमस सप्लाइड बाय सुपीरियर ग्लूटिल नर्व, बट जो मैक्सिमस है इट इज सप्लाइड बाय इंफीरियर ग्लूटिल, इंफीरियर ग्लूटिल नर्व सप्लाइज जी मैक्सिमस। हाँ जी, ठीक है, याद रखो। चलो लेट्स सी, एक और क्वेश्चन करते हैं, चलो भाई। अब अपर लिम्ब से कूदते हैं सीधे, सॉरी लो लिम्ब टू अपर लिम्ब। ध्यान से, दिस क्वेश्चन इज इंपॉर्टेंट। अपर लेटरल क्यूटेनियस नर्व ऑफ आर्म, आई होप यू ऑल कैन सी, so I should have brightened, but chalo, I will read the question. Upper lateral cutaneous nerve of arm is a branch of ABCD. A and D. A क्या है? musculaneous, D क्या axillary, अच्छा, then A, अच्छा, A, D, A और D में there is a tough fight between A and D, आधे A आधे D, ओह कैसे होगा ये तो प्रॉब्लम। Let me see, 4 votes are going with A and 2 votes are going with D, तो A सही होना चाहिए, बट एवरी टाइम डेमोक्रेसी का तो नहीं सुन सकते ना, क्वेश्चन तो क्वेश्चन है, we don't have to only go with the democracy। हाँ जी, more support with the D coming, very good, DD। अच्छा श्याम DD 3 बार, okay, more votes went with D। चलो श्याम, श्याम alone gave 3 votes to D पे जाएंगे फिर तो, D जीत गया। आंसर is actually enough। Now C over here, this is the neck over here। हाँ अब आ गया C, D हो गया। चलो this is the neck, this is shoulders, imagine ये हो गई arm, forearm, and imagine the hand over here, ठीक है, same way these are the digits, forearm over here, this is the lateral side of the arm, that is the medial side of the arm। एक बात याद रखो यहाँ पर, प्लीज डू रिमेंबर, यहाँ पर एक पैच बनेगा, second patch over here and the third patch over here, these are 3 patches, these 3 patches are representing the cutaneous nerve। This black line is the cubital fossa, so A, R and M is the mnemonic, ये mnemonic है। What they asked you, upper lateral cutaneous nerve of arm is this between shoulder and the elbow, so it is asking you ये वाला, that is A is representing axillary nerve। अगर ये पूछता लोअर लेटरल क्यूटेनियस नर्व आर्म, इफ इट वुड हैव आस्क्ड दिस, आंसर वुड हैव बीन रेडियल नर्व, दिस वन। इफ इट वुड हैव आस्क्ड यू लेटरल क्यूटेनियस नर्व ऑफ फोरआर्म, एज मोस्ट ऑफ यू जिनको यही याद है, दैट इज मस्कुलोक्यूटेनियस, ये एम से बना मस्कुलोक्यूटेनियस, दिस इज मस्कुलोक्यूटेनियस, रिमेंबर दिस निमोनिक, याद रखो, दिस इज मस्कुलोक्यूटेनियस नर्व। हाँ, लोअर लेटरल नहीं बेटा, लेटरल क्यूटेनियस नर्व ऑफ फोरआर्म, इसमें फोरआर्म में देयर इज नो लोअर एंड अपर, फोरआर्म में दिस होल फोरआर्म, ये पूरा का पूरा मस्कुलोक्यूटेनियस, दिस होल इज मस्कुलोक्यूटेनियस। आर्म में देयर इज अपर एंड लोअर, लेटरल, अपर इज ए फॉर एक्सिलरी एंड लोअर इज आर फॉर रेडियल। खत्म, निमोनिक याद रखो, सिंपल निमोनिक है आर्म, ए एंड आर ऑफ द आर्म, एम आता है मस्कुलोक्यूटेनियस इन द फोरआर्म, इसको याद कर लो, कोई भी क्वेश्चन आ जाएगा, यू कैन फ्रेम मेनी क्वेश्चंस फ्रॉम दिस। लेट मी शो इन इमेज आल्सो, एक इमेज भी है, देखो, this over here is the upper lateral cutaneous nerve of arm, axillary nerve, यहां बना this is coming from the radial nerve, और ये पूरा का पूरा है musculocutaneous lateral side। clear? Let me see if any other question left, एक और क्वेश्चन कर ले, लास्ट क्वेश्चन, if all of you are ready, ठीक है, चलो एक लास्ट क्वेश्चन किया जाए। which gland is supplied by glossopharyngeal nerve, which gland is supplied by glossopharyngeal nerve, the mandibular, lacrimal, पैरोटिड और सबलिंगुअल, बताइए। सी, अरे सबके सब पैरोटिड पे जा रहे हैं, आर यू श्योर? सारे जा रहे हो देन पैरोटिड ही करते हैं, इट इज डेफिनेटली पैरोटिड, वेरी वेरी गुड, वेरी गुड, आई नेवर थॉट कि सबके सब एक साथ पैरोटिड पे जाओगे, ऑल ऑफ यू विल आंसर इट सो फास्ट एंड सो कन्वीनियंटली, वेरी गुड। So glossopharyngeal nerve, ninth nerve gives off a, अब यहाँ पे सुन लो एक मिनट के लिए, lesser petrosal nerve which goes to otic ganglion, और यहाँ से there is a nerve which goes to supply the parotid gland, which is that nerve, मैंने बताया था अभी, I just told you a while back in some of the questions. Ninth nerve gives off a lesser petrosal nerve that goes to otic ganglion. Through a nerve, it supplies parotid gland. So, कौन सी nerve that you can answer? Submandibular salivary gland में this I can answer. The seventh nerve over here gives the cauda tympani nerve, which goes to submandibular ganglion. वहां से it supplies a submandibular gland via maybe lingual nerve branches. Lacrimal gland again, seventh nerve gives rise to greater petrosal that goes to pterygopalatine ganglion. वहां से V2 branches supply lacrimal gland. V2 और V1 आता है, but sublingual is same as submandibular. Answer is no doubt C. अभी तक इसने बताया नहीं which nerve over here. Which is this post-ganglionic nerve supplying the parotid gland? बिना इसके बताए भागो मत. Don't run away without answering this. I told you this 10 minutes back. 10 मिनट पहले बताया था. याद कीजिए Frey syndrome. Gustatory sweating. Greater auricular is having connections with which nerve? That is post-ganglion to parotid. That is very good. आगे आंसर auriculotemporal nerve. इतना you took so much of time. इतना भी very good नहीं. Should have answered it earlier on. But this we just discussed 10 minutes back. ठीक है, चलो fine. So remember the glossopharyngeal nerve is supplying this parotid gland. बाकी तीनों supplied by seventh nerve. ठीक है. So if they ask you which are the parasympathetic cranial nerve, what is the answer? Last चीज बताओ. Which is the parasympathetic cranial nerves? कौन सी nerves हैं? वो last question of the night. Day तो नहीं हो सकते. It is a night around 11 now. बताइए. Which is the parasympathetic cranial nerve? You are seeing a couple of here right now. Shabash. Sham is the first one to give the correct answer. In one go, 3, 7, 9, and 10. Very good. 3, 7, 9. 7 and 9 you are seeing over here. C 3 is for the adding a vesical nucleus, the ciliary ganglion. और 10th के तो कहने ही क्या? 10th thoracic viscera, heart, lungs, foregut, midgut सब जगह. 3, 7, 9. अरे very good, very good, very good. वाह, very good. Vibes, Mobin, Devangan, all of you very good. So guys, this was our few of the important MCQs. I hope you enjoyed it. Okay, and that's all. Any doubts, let me know. And also any doubts, you can reach me out in the Telegram groups, or you can even subscribe. So remember, tomorrow we have a Med Combat, and do please give it a good chance. You can enroll by using a code Dr. Ankit 10. That is a code that you can use to enroll in the tomorrow's Med Combat. It is yearly wise exam, so कोई दिक्कत नहीं. If you are in first year to लेकर post enter तक कोई भी बीच में, whichever category you are, whichever stage you are, you can give the exam. Right? There's so much of exciting prizes also to be won. Obviously, there's gaining of knowledge. So that's all from my side. I hope you enjoyed. Bye bye and good night. Take care. It is around 12 in the afternoon, I guess. 12 afternoon.